Hiya, I'm Saran.
And my name's Dale.
And we're here to talk about the Assertive Outreach Team. It's a community team based at East Brighton Community Mental Health Centre.
We'll see people in their own homes, or sometimes they come to see us here, or out in cafes, out and about, but right the way across the city from Saltbean to Mile Oak.
We were set up so that we have lower caseloads. That enables us to see people more often, and that can be daily. For some people, we do see them daily. That's quite often around medication and compliance with medication. So that's one of our functions. As a team, we have consultant psychiatrists, we have a psychologist,
support workers, nurses, social workers. We have occupational therapist in the team.
So Dale and I are both support workers in the team. It's I think it's quite a unique role. We're able to build a long-term relationship with people. We get to know people really well, and we have time in order to be able to work with them creatively. So it might mean that we go for cups of coffee with people. We're there at a time, you were saying, when they want to talk. So quite often they will share how things are going. We don't have to go in with a real kind of mental health stance. We're much more able to get to know people and know what's going to help them, really.
So by seeing people regularly, by continuing to not devalue the opportunity of just having a coffee, having a casual chat, that somewhere in that, if you're using your observation skills as a skilled worker, as I think the sort of support workers are, you're kind of sourcing all the time, what does this person talk about a lot, what do they, even from what clothing they've chosen to wear, what colours they like, what music they listen to, there are lots of different ways to find out about a person that doesn't rely on a simple question like, what are your interests? You can be resourceful to kind of find out, kind of in a holistic way, lots of things that are interesting to people, and that helps guide the suggestions we might make.
And I think we have then the actual time to go and do some of these things. For example, yesterday I went to the 50 plus with somebody because they're kind of tentatively thinking that might be a good idea, but maybe wouldn't go there for the first time on their own. So kind of went along and gave the person the opportunity to go and have a look and see what they think about that.
I think as well, you're talking about sort of accessing groups and things, and I think that is for the people that feel that they're able to attend groups. I think what's different for our team is that there's not so much of an emphasis on what people might need to do is engage in groups with other people, which might be daunting for them. Because we can see people more frequently, people like Saran and myself will try and take on some of that kind of work with people on a one-to-one level. So if someone's interested in art or yoga or all these sorts of things, but wouldn't necessarily feel comfortable going to a group just yet, we can still explore that interest through doing things on a one-to-one level. So for example, myself, with somebody who is interested in art, we've done a city trail and gone around all the different public pieces of art and talked about them. We've looked on the iPad using some of the trust technology to kind of help with that and kind of research the artist, and that was just done on a one-to-one level. So we're there recognising that a person has an interest in something, but also that they might find quite nervous to go and go to a group and not necessarily got the motivation just yet to do that on their own. We can kind of start to make suggestions of that with what we do together, and I think that's what's really great about working with our team, is that it's not time limited by you have to do 6 weeks worth of work with this person, and by that time they might need to be able to attend that thing on their own or to be able to go to a group, and we're not putting that time limit on something. We're looking for opportunities when you might be able to, but not saying you have to in a short period of time.
Absolutely, and sometimes it is about that relationship with us, actually, to start with, because quite often people's relationships are broken down. That's a huge problem when their mental health has been unstable for such a long time, in and out of hospital. Quite often family relationships are broken down, friendships aren't there anymore. And sometimes we're the first kind of relationship, so it's a kind of new building on relationships, and getting to remember how to do that, I think, isn't it?
And that is actually a really good place to start, and we've got the time and the resources to do that, and I think that's really special about the team.
And quite often people want practical support, don't they? They want practical support, they want to go shopping or sort their bills out or sort their money out, and then I always think about, them being able to talk about mental health walking around Sainsbury's, just on a kind of very informal way, but actually you can kind of support people quite well rather than just sort of sitting down and it being very formal. It's about their recovery actually, and I think that's what's really important in this team as well, is that we don't have, recovery is often seen as like getting back to work, or I think it's often getting back to work and living on your own. However, I think in the Assertive Outreach Team we see that for different people their recovery is going to be something different to that, but it's going to be something for them.
Absolutely. And I think, one of those key goals for a lot of people that we see people, do reach, over time, is just not having been admitted to hospital so frequently, maybe. For some people, I think, as a goal, before work, before other things, although those things might be a factor in why that might not happen, but, there is that sense of early intervention with people, and maybe just as an initial goal, let's see if we can extend the period of time you've been able to be at home,
or even a shorter admission.
A
smoother, shorter admission, because that's the other thing I think we do differently to other teams, is we see people while they're in hospital as well, so they don't have that kind of cut off. We see them all the way through, and then there for when they go home as well. So I think that makes a difference.
I feel very privileged in this role to be present in people's lives, to really help, kind of listen to their story, what's been going on for them in their lives from their perspective.
And their strength.
Absolutely, their strength and their hopes for the future.